With the Affordable Care Act, there will be around the country, what you're going to see is an expansion of access for uninsured. There's one state that we can look at that's actually done this. Massachusetts did an expansion. They did an insurance mandate in Massachusetts where people were required to obtain insurance, and there were subsidies to help people purchase insurance. And the question of the safety net systems there, primarily in Boston, Cambridge Health System and Boston City, those two large safety net systems actually saw an increase in activity when the insurance mandate went into effect, and that confirmed what a lot of people suspected, thought would happen naturally. As the uninsured gain greater access to care, they're going to seek care for needs that they previously didn't seek care for. And so in Louisiana, and we know this happens today in Louisiana, if you look at the access to care or the utilization of services among uninsured and insured, the insured utilize services at a greater rate than the uninsured. And so when you provide that coverage to the uninsured, you can expect to see an increase in utilization. Louisiana already is a state with the majority of the state being a health profession shortage area, whether that's mental, dental, health, physical health shortage area. There are large health profession shortage areas all over the state of Louisiana. And so you're taking a state that's already got shortage areas, you're adding an insurance coverage program or Medicaid coverage, assuming we eventually get there, which I think we will, but then you're going to create more demand for services, which I think has implications right now for the safety net and also for the GME programs, where you're going to have to continue to train our own providers to meet that demand, and I think we're going to see some negative impact in the GME programs with some of the changes going on as well. But that's a common question about, well, once everybody gets insured, you don't need the safety net. Massachusetts proved that once you insure everybody, you need the safety net even more, because you've still got that volume of patients that have been uninsured. Now they have insurance, they're going to seek services to a greater degree. You need the providers to do that, and we don't have enough providers today to do that. There was an article a couple of years ago now in the New England Journal that looked at health access index, if you will, which states were going to have more of a challenge dealing with the coverage expansion of the Affordable Care Act. And Louisiana was at the top of that list. Basically, they looked at the number of uninsured you'd have that would be coming on and the number of primary care providers that you have to meet the demand. In Louisiana, within that ratio, we ranked worse than almost every other state because we had more people that would be coming on and we had fewer providers to accommodate.